Okay, now that we've worked in through the neck and I've shown you guys some upper trap techniques and some neck techniques, we're going to work on the shoulder. So take a little bit of lotion or wax, whatever you want to use, apply it over the area just to get a little bit more glide. And then once again, you could do some sweeping strokes. You can use your body weight to just kind of pull back and sweep along the area. And you can go along the teres minor. You can get in the infraspinatus and just along the shoulder blade itself. And then when you're in this area, you can do some brushing along the supraspinatus. This is really good for kind of breaking up everything along this area where things tend to get bound up, especially with forward posture. Once again, reinforced fingertip, and you're brushing down the spine of the scapula. This is also really great for trigger point release, so you can find a trigger point. Typically there's going to be one here in the upper traps. There's usually one in the rhomboid somewhere. So you can use the tool and reinforce fingertip and press down and communicate with the client. And after they've done a couple breaths and it feels like it's releasing, you can kind of slowly come out with the tool. It's a great way to save your hands. And then you could go keep brushing. You can kind of strum along this area as well. Strumming is really nice along the rhomboids, and especially if you want to open up just in the subscap. This is going to be great for opening it up and a good precursor to actually getting your hand in there. If a lot of people have some sort of issue here where it's really tense, you can use a towel. So you can roll up a towel and place it underneath the shoulder, and that's going to give you some access to get in along the scapula. So you can kind of do this cross fiber motion here. This is really nice for opening up everything around the subscap. If you really want to get in there and kind of address some different trigger points, you can do this kind of technique like this. You can also turn the tool this way and work it like that as well. You can even just do a static release where you hold the tool in this area and just allow it to kind of sink in and kind of slowly work with the breath. And you're kind of just doing a little bit of an oscillatory technique and just sinking into that tissue. And then once that's done, you can keep working in this area, work multi-directionally. If you find a trigger point, you can even brush around it to make sure that it has less of a chance of coming back again. So let's assume there's a trigger point right here. You can brush all around it in different directions. And if everything around it is kind of released, then it's also going to help to make sure that that does not come back. A really nice way to access the shoulder as well is in the sideline position. So here we have Kate. She's got a pillow under her head for comfort. You can bring the arm straight like this. You can also work on the arm in this position. So just put a little bit of cream there, and then you can kind of glide along the fibers of the deltoid. And you're just doing some nice little scanning strokes. You're seeing how everything's feeling in this area through the tool. And then you can kind of go down the side of the arm, just do some nice sweeping techniques. And then you can get really creative. So I can grab her arm and I can kind of bring my wrist around here. And then you can work in through the shoulder here with the teres. So you can work down and sweep like this, which is really cool, something that your hands just really can't do. And then you could use a little bit of movement. I find when you're using these types of tools, having the tissue in kind of a stretch position is actually really nice and helps with just getting everything unstuck. So you can do these kind of shorter strokes in this area. You want to make sure to be very cautious around the axillary area. From what I've seen, there's no real need to go in there. There's a lot of sensitive tissue, lymphatic system, nerves, so there's no real need to kind of go into this area. So yeah, just kind of stick to the outside here in the teres. And you can keep moving them into a little more of a stretch position as you work through it. And as you're doing this, you also want to note that you don't want them to have any bruising. So she has a little bit of redness, which is fine. She can even get a little bit of petechia in this area, which is also fine. But once you hit that petechia, you want to make sure that you stop kind of doing the techniques, because you don't want to push past that into bruising. So sometimes the tools can get a little bit slippery if you've had lotion on your hands, so just readjust and just keep working in this area. And you can kind of work down the tricep here as well. Do some nice little strokes down there. Tricep typically doesn't need that much treatment, but it's still nice to kind of work up and open up through this entire line. And then you can bring the client back to neutral. You can also work into the upper traps in this position as well. So make sure you work kind of under the strap and make sure the client's comfortable with that, and just communicate with them before you're going to do that. And this is also a really nice way to work along the spine of the scapula. So you're kind of continuing forward from that technique we did on the supraspinatus by just working down this area. Now there's going to be some bony contours here as well, so you can also work along those, but being very cautious. You can do kind of a little scoop stroke like this, and then you can kind of scoop into the upper traps as well, which is a really nice one. And it's a great way of kind of working up into the neck, getting very specific. So you're thinking of, when you're using this tool, how can you use it within a continuous flow of a treatment and kind of work from one area to the next, and everything kind of connects. So it's a continuation of that technique to this technique and so forth. So with the scoop technique, basically you're reinforcing your fingertip, and then you're just kind of working up like this. So you're kind of angling the tool and then working up into the neck. And this is a really nice way, and another way, to work the upper traps. Now another thing you can do is I can get Kate to hike her shoulder into my hand, do a muscle energy technique with 20% force that she's using. And then after 10 to 15 seconds, I can get her to relax and then take a deep breath in. And then as she takes a deep breath in, I'm going to move her shoulder down. And then what I'm going to do with the tool is scoop and sweep up. So I'm pushing her shoulder down and then sweeping up with the tool. So creating a really nice stretch. Now this is really going to help with range of motion. And really, it just is a feel-good technique. Most people, I think, associate bringing their shoulders towards their ears with stress. So anything you can do to kind of alleviate that or show them how much tension is in this area is going to be really educational for them. And this technique is also going to help them to drop their shoulders and feel what it's like to be in a more relaxed position. You can even do some quick little brushes as well in this area.